I'm Dr. Srijan, and today we are going to start a new series of video that is on chest CT scan or HRCT thorax. And this is the first video of the series, that is Introduction to CT scan. This video lays the foundation of all the upcoming videos. There are few very critical concepts which I'll be discussing in this video, and I'll be using these concepts in my upcoming CT scan videos. So, without any delay, let us start. I'd like to start with a question. How does fluid look in chest X-ray? I've already spoken about chest X-ray in great details in my previous video. Thank you for all the love you have showed me. So, if you have not yet watched, please do go back and watch the video once you complete this video. So, coming back, how does fluid look in chest X-ray? In chest X-ray, fluid is always white in color or it's opaque. Now, let me extrapolate this question. How does fluid look in chest CT scan or HRCT thorax? If your answer is fluid looks white in CT scan, I'm afraid it is wrong. If your answer is fluid looks black in CT scan, I'm afraid it is wrong. And between black and white, there is multiple shades of gray. So if your answer is out of the 50 shades of gray, it will be either one shade of gray. I'm afraid that's also not the correct answer. And I'll tell you the reason why I'm saying so. I've discussed it in this video. Okay, so let us start. Whenever a patient comes to you and hands you over a CT scan plate, basically it looks something like this. I want you to remember this image where a patient is lying in the CT scan machine. His feet are pointed towards outside, towards you, and his head end is far away. Now imagine a plate over here. I want to show you an analogy. Just just imagine that this is a loaf of bread and we have sliced the loaf into multiple slices. We slice the patient's body like a loaf of bread. You pick up one slice from here. Always, when you get images like this in your CT scan, this is one slice what I'm talking about. Here, in this part, you must remember that the patient's foot end, you must imagine that the patient's foot end is projecting. Whenever you are seeing a CT scan plate, always imagine that the patient's legs are projecting towards you outside the plate, and the patient's head is far away, or it's just the opposite or behind the plate. This three-dimensional imaging is very crucial, because once you imagine like this and you start reading from the CT scan, you'll see that progressively while you go down, you are able to correlate more easily. The second I talked about this because of the side determination. This is the left side of the patient. This is my right side, but this is the patient's left side. So this will be the left side. This is the patient's right side. You all will agree. So this CT scan is the right side. I've already marked over here. This is the right side. This is the left side. In a busy OPD, just remember one thing. If your right hand points to the side, that will always be the opposite, that is will be the left side. And if you hold a part of the CT with your left hand, that side will always be the right side. So coming to the next concept. Now, whenever you get a film, you get mainly three sections in it. CT scan is always taken axial sections. By axial, I mean this section, and then it is reformatted. It is known as multiplanar reformatting, MPR. So we get sagittal sections, we get coronal section. This is a coronal plane from front to back, and from side to side we call it the sagittal section, and transversely we call it the axial sections or the axial cuts. So once we have spoken about the sections, now I want to speak very briefly about a concept of voxel. We all are aware of the pixels. The more number of pixels in your camera, the better resolution or the better quality you get. Same concept applies in CT scan. CT scan is always taken in slices. So this is the thickness of the slice. When pixel is a two-dimensional structure or two-dimensional unit, whenever you add this thickness to a pixel, it becomes a voxel. Just remember that the smaller the number of voxel, or please understand it like this, that the more number of voxel in a frame, the better the resolution is, the better the clarity of the CT scan plates will be, the better detailing it will be. So smaller the voxel, better the clarity, better the detailing in the CT scan. Okay, so let us proceed further. Now, I want to ask you a question, and this question maximum people get confused. Which is more denser? And either it is fluid, that is water, or fat. So maximum people will say that water is less dense and fat is more dense. But tell me, if there is a glass of water and you pour some oil or some fat, it always floats, which means that fat is less denser than water. Now, whenever we get a CT scan done, CT scan in the CT scan machine, we can, or in the console, we can measure the density of the tissue whenever CT scan is done. The unit is Housefield unit. So, by convention, water is always taken as 0 and air is always taken as -1000. These are fixed values. And there is some ballpark number which you should always remember. Like fat is always -100 Hounsfield unit, water is 0, air is -1000, and soft tissue is around +50. So these are these numbers which I want you to remember right now. Fat -100, soft tissue +50, water is 0, air is -1000. These values you have to remember. If you get blood, and that's an acute bleeding, remember I'm talking about acute bleeding, it's around 60 to 90 Hounsfield unit. Now let us proceed. Here in this section, I have marked some ROI. What is ROI? ROI are the region of interest, or basically in simple words, the area where I want to find the Hounsfield unit. I have marked this part. 1, 2, 3, 4, 5. These 5 are my region of interest. Once I've marked over here, see it is showing that it is -998 Hounsfield unit. That is approximately -1000. I've marked in the air. Second, I marked in a fatty structure. It's around -125 Hounsfield unit. Fat is around -100, which I said it's near to 100, -100. Now, coming to the liver, I have marked in the liver it is showing 29.5 Hounsfield unit. I'm a bit worried. This should not be the what the liver density is. Now I marked the spleen. It is around 49.7. Fine. Always and always remember that liver should always be more dense than spleen. So for the spleen, always remember that it is around 40 to 50 Hounsfield unit is the normal density of spleen. Coming to the or talking about the liver is should be around 50 to 60 Hounsfield unit. But here the liver is less dense. This means that it may be a case of fatty liver. So I have marked the area of bone. It's around 538 Hounsfield unit. So here lies the importance of Hounsfield unit. Basically, Hounsfield unit means it measures the density of the tissue or the structure which you want to measure. So now I want to talk about a very important concept in CT scan, that is windowing. Tissue density in human body generally ranges from minus 1000 Hounsfield unit to plus 1000 Hounsfield unit, minus 1000 being air, plus 1000 being solid tissues, that is bones. So basically, this is what I want to show you. Let me show you in this image. This is minus 1000 to plus 1000. Now, if I extrapolate all the possible shades of gray between these two zones, this is what I am getting. Minus 1000 being the darkest, plus 1000 being the Hounsfield unit, being the brightest or white. I have already said that soft tissue is around plus 50 Hounsfield unit. So if there is even a slightest pathology, or if there is a slightest change in density in the Hounsfield unit of soft tissue, do you think that this small change in the shade of gray is perceivable by the human eye? No, human eye cannot perceive this very small minute changes in the shades of gray. What if I do something like this? I reduce this difference in the shades of gray into this small zone. I start at minus 150, I end at plus 250 Hounsfield unit, and I distribute all the shades of gray between this range only. As a result, what is going to happen is, see, it's so interesting. At 50 Hounsfield unit, even if there is a slight change to 60 Hounsfield unit, a change in the density of the soft tissue to 60 Hounsfield unit, there will be a marked change in the shades of gray, and that is what I wanted. So this concept is known as windowing. Basically, here are two things: a central point or a level at which window is centered, and the total width of the window. See, minus 150 to 250 plus 250. What will be the width? Minus 150 to 0 is 150, and plus 250, that comes around 400. So width of the window is 400. And at what level it is, or what it is centered at? It is centered at plus 50 Hounsfield unit. What about we reduce this further, so that even with more smaller changes in density, we can appreciate much more better, because the shades of gray changes more abruptly. So here with a level of plus 50 Hounsfield unit, this is the center, plus 50 is the center, and width is around 150. So you divide 75 this side, 75 this side. So it starts from minus 25, it ends at plus 125 Hounsfield unit. After plus 125, everything is white. So this means that a density of a tissue which is at 200 Hounsfield unit, it will look white. A tissue which is having density of 300 Hounsfield unit will look white, and everything above this, above 125, is going to look white. Same goes with the other way around. Anything which is below minus 125 looks black. Now let me recall my question. In the first, I said, how will fluid look in CT scan? So it all depends at which level and at which width you are. So fluid is always, free fluid is always at 0. So let me imagine that if I level at 50 and if my width is around 40, so anything below 40, below 10, so basically I'll be reducing 40 from this level, that is around 10. So anything below 10 is going to be black. So I'll get a black image. Basically I'll get a black in the CT scan, black density in the CT scan. Same goes the other way around. If I am taking a level of minus 50 and my window width is, let us assume it's around 80. So first is I will divide my level into two parts, that is at minus 50. So 40 will be 40 this side and rest 40 is this side, and it is leveled at 50. So it is minus 50, it is minus 10. So anything which is above minus 10 is going to look white. Always remember this. So it is not just absolute value that it will look, fluid will look white or fluid will look dark. It all depends upon your windowing. Now there are few standardized windows I'm going to talk about. So if we want to see the soft tissue in a better way of the abdomen, the window width should be around 350 and the level should be around 50. We, being the pulmonologist, we use lung window where the window width is around 1600 and it is leveled as minus 600. This means that it is centered at minus 600, and I will be dividing 1600 into two parts, 800 to the left, 800 to the right. So what is going to happen? From here it will be 800 plus, that is around plus 200, and from here it will be minus 600, you add 800, it will cross, it will be more than 1200, minus 1200 Hounsfield unit. Everything is, and back to this, everything is going to look black. So I've shown you an image. This is our lung window which I'm talking about. Here the architecture of the lung parenchyma looks very distinct and clear. This part, if you see this image in the middle, you see that the middle part, that is the mediastinal structures, are much more prominent. So this is a mediastinal window which I'm talking about. If you see in the third image, all the bones are very prominent. So this is a bone window, and here is a bone window which is windowed at 2000 and leveled as window width is 2000, leveled at 500. You don't need to remember these numbers. This is just an explanation of why different densities or different or the same structure looks different in different plates. So please remember that whenever you get a plate of CT scan, you do not get a single plate. You get two plates. One is the lung window, the other is the mediastinal window. And I hope the concept of window is very clear to you all. What are the types of CT scan? Since we are talking about the basics of CT scan, I would like to talk about the types of CT scan. First is a non-contrast CT. It's a very simple basic CT scan mainly used to find gross pathological problems, calcifications and nodules like this. So I want you to first see these two images. Here, this is a film of NCCT, non-contrast CT or plain CT, and this is a film of HRCT. The only difference is I can see minute structures in more details, in this part, whereas in this part the minute structures are not visible clearly, only the gross structures are seen. So if you want to see alveoli and if you want to see them in details, please write HRCT thorax. Okay, there is a third part, that is low dose CT. It is mainly used, okay, so I've not mentioned over here, it is mainly used as a follow up of cancer patients or malignancy patients so as to reduce the amount of radiation to the patient. How is it done? We use a low tube current. So basically the current in the tube is lowered. As a result, the dose of radiation which is being given to the patient in each CT reduces significantly. So once we are done with the CT scan, I want to show you this image. Now see, first question is this a lung window or is this a mediastinal window? The lung parenchyma is not visible clearly, but I can see or delineate the mediastinal structures, but not clearly. So this all four are mediastinal window. Now, if all the four are mediastinal window, why there is a difference in these structures? In this part of the mediastinum, I cannot see the structures clearly of the mediastinum, but in this I can see it clearly because these are contrast enhanced CT scan. By contrast, I mean that the radiologist has injected some iodinated contrast in the body. It is generally around 50 to 150 ml of contrast is being given for each study based upon the nature of study. So whenever we are injecting the IV contrast, which is radio opaque, it travels first into the through the vein into the right side of the heart. Once it enters from the right side, it crosses the atrium, ventricle, then it goes to the pulmonary artery. As soon there is a specific time that within 15 to 20 seconds, this contrast generally reaches the pulmonary artery and we take a snap at that part. So we get something like this. Then the contrast enters into the left side of the heart. From the left side of the heart, it goes into the left atrium, then into the ventricle. From the ventricle, it comes to the aorta. So basically, at around 20 to after 20 to 30 seconds of injecting a dye, if we are taking a snap, we generally have the contrast in the great vessel, that is the aorta. So this is what I was talking about, CTA or CTBA, that is CT angiogram of bronchial arteries or CT angiogram of aorta. Now, if we wait for a longer time, that is around 3 to 10 minutes. I'm not talking about seconds, I'm talking about minutes. So if you're waiting for around 3 to 10 minutes and let all the contrast equally distribute, or we call this the equilibrium phase or the delayed phase also, where all the contrast has equally distributed in the complete all the vessels, then we will get a picture like this. This is known as equilibrium phase or delayed phase. This is what I was talking about. So basically the crux of the story is we have a pressure injector and all the timings are set, all the protocols are set. You just push a dye and you take some pictures. Depending upon on which stage the pictures are taken, the nomenclatures are different. Let us proceed. Okay, I want to show you some clinical importance of taking some contrast pictures. Can you see this IVC? This and this side. It is very hard to delineate that something is here, but in this there is such a large thrombus, and this is a delayed phase imaging. And just see, if you have not taken this delayed phase imaging, you would for sure miss this thrombus. I want you to see two pictures. This is a non-contrast study and this is with contrast. So when you have added contrast, can you see the thrombus in this IVC? This is the thrombus of this. This is the same patient which I showed you here. So had I not done a delayed phase, I would have for sure missed this large thrombus. And to show you one more picture, do you see a small dot over here? This is without contrast and this is with contrast. So chances of picking thrombus is much more higher if we are using contrast. Okay, so now when the CT scans are taken, now we can reformat the raw data and produce some specialized image. I want you to focus over here. Can you see that in this image we do not see many blood vessels? But as soon as I reformat this data and I switch or I click to this mode, MIP mode, all the blood vessel protrude or become highlight. Same is in this case. This is a normal image, this is a MIP image. So what do you mean by this MIP? MIP means maximum intensity projections. See over here. This is what I was talking about. Advanced post-processing tools. Basically, after we have taken a simple image, we reformat the raw data into different views and specialized display. One of it is MIP that I'm talking about, maximum intensity projection. It is excellent for detecting subtle lung nodules and evaluating vascular structure. Basically, whatever high intensity structures are, they will pop out. The same goes with MINIP. MINIP means minimum intensity structures will be highlighted. I will show you in a second. This is a normal image versus this is a MIP image of the same patient, and this is a MINIP image. If you look or observe clearly, you will see black dots. So, low density structures or minimum intensity structures are projected out. So, if we want to track a patient who is emphysematous, we are going to use this form, or wherever there is air trapping, we are going to use this form. This will help us to identify the patient much more easily. And at last, we have something known as volume rendering and virtual bronchoscopy. Virtual bronchoscopy is very simple. Virtual bronchoscopy means within the CT console only, you are going to get a idea. This is what I'm talking about, virtual bronchoscopy. You'll get an idea of the airways. You don't need a bronchoscope to enter and then you need to perform. You'll get an idea beforehand. Now, what is volume rendering? That is, volume rendering is to create a realistic 3D image, something like this. We are creating a realistic image. It does not has much of it use. Only simple thing is that we mainly use this for navigational biopsies. This is what volume rendering stands for. So hereby I conclude this class, and I thank you all for your presence. And this was a very important class. I hope this was small, but please do not skip any part of this class. Thank you. Thank you so much.